My name is Cordelia Padua, a DMP student at Brandman University. Today, I will present my innovative project video proposal. Objectives. The objectives for this video proposal will address the following questions. What problem will this innovative project solve? What is known about this problem? What is the proposed mobile application used to solve this problem? With whom did I collaborate when completing this project? Why is my proposed solution innovative? Problem. The problem that this proposal intends to solve is adolescent suicide. Suicide is defined as when an adolescent causes his or her own death on purpose. Suicide ideation is when an adolescent has thoughts of wanting to die. Suicidal behavior is when an adolescent is focused on doing things that will cause his or her own death. The most significant risk factors identified include mental disorders, past suicide attempts, personality attributes, family effects, life event futures, and contagion limitations. The solution to this problem is the adoption of continuous quality improvement framework that offers help at the individual, organizational, community, and societal levels to ensure that all risk factors are addressed. Unfortunately, suicide crosses all age, racial, and socioeconomic groups in the United States and around the world. In the United States, suicide is the second leading cause of death among children and adolescents ages between 10 to 24 years of age, and also the third leading cause of death among 12-year-olds. Nearly one of every 8 children between the age of 6 and 12 has suicidal thoughts. When suicide occurs, everyone is affected, including people who are left behind. Background. The following are the background and significance of this problem. According to Bilson 2018, suicide among youth has led to the loss of many lives, disruptive psychosocial effects, and severe socioeconomic effects. Public mental health reports indicate the need to address suicide in adolescents, consequently understanding risk factors that increase suicidal tendencies among them. According to CDC's National Centers for Health Statistics, there was a 24% increase in the rate of suicide between the year 1999 and 2014. The use of structural assessment, screening tools, and mobile application will enhance processes in identifying high-risk patients that require immediate intervention. What is known about this problem? Globally, suicide is the second most common cause of death after road traffic accidents among young people aged 15 to 24 years of age. Statistics show that suicide rates are high in the older generation compared to youths, but remains a leading cause of death among adolescents globally. In 2014, an estimated 6,912 young people living in the most developed countries in the world lost their lives to suicide. The United States stand out as a country with most significant youth suicide problem, accounting for 77% of total costs. These preventable deaths resulted in a loss of 406,730 years of life at the cost of $5.53 billion in lost economic income, with the average cost of suicide estimated at $802,939 in lost revenues. Suicide prevention tried in the past includes means restrictions, responsible media coverage, general public education, as well as identification methods such as screening, gatekeeper training, and primary care physician education. Intervention may fail and sometimes ineffective because unfortunately, suicide is a medical health crisis. It is difficult to prevent in large part because the prevalence of risk factors is high among the general population. Innovation solution. My chosen mobile application for this project is Calm Harm. I chose the mobile application because it is aimed to assist people experiencing self-harm. It is intended to help adolescents regulate their emotions and work through overwhelming feelings without harming themselves. The user is educated to use coping skills until emotions are under control and the urge to self-harm is less intense. The application is user-friendly. It is easily accessible using conventional smartphones anywhere in the world, in the US and the world at large. It can be downloaded for free of charge. The next slide will present the mobile application, Calm.
When I'm getting panic attacks, it's quite a lot of the time it's at school, and it usually involves going into classrooms. I'll be at the door and I just cannot go in. Usually ends up in me breaking down and having to leave, but so I've kind of learnt to take myself out of the situation.
My name's Dr. Nahara Krause. The app's called Calm Harm.
I recognised my feelings as anxiety and my eating disorder. I didn't really think they were a thing, essentially. It was, I'm just a bit nervous today, or I'm just a bit upset.
One of the things I'm recognising, both with my professional hat on as well as being a mum, is what a lot of pressures young people experience today. So apart from difficulties in managing stress, anxiety is very high.
For some reason, every time I try and get to sleep, I get panicked and anxious.
And young people are really trying to find their own solutions.
The app's quite open, you can choose what you do with it. So it's all kind of stuff just to like distract or comfort or reassure you that you're okay, but you just need to get through the urge. I have my phone by my bed, I just get it out and I do the breathing, and I can do it for 5 minutes, 10 minutes. I mean, Calm Harm has made a huge difference. It's made me feel reassured in myself, comforted, and something that you can rely on to be there every time you feel upset.
The feedback that we receive is really wonderful. The testimonial from India is amazing and definitely seen an enormous difference in her. So really very, very proud of her and really pleased.
It's such a versatile tool to have just on your phone or your iPod or anything. You can just use it. It's just amazing.
I'm really humble and proud to be able to support so many young people. The platform that AXA Help Tech and You has provided us has been absolutely incredible. It has enabled us to be recognized for producing something which makes a big difference, particularly for a small charity like ours. And hopefully we will continue to meet and expand our relationships with other amazing companies.
With whom did I collaborate when working on this project? To complete this proposal, I collaborated with the following people. First, a trained psychotherapist in a behavioral and mental health hospital, the supervisor of the outpatient clinic within this hospital. He is responsible for daily conduction of therapy sessions for patients diagnosed with stress, anxiety, depression, bipolar disorder, negative behavior patterns, debilitating feelings, and various other mental conditions. He has 25 years experience in the care of mental health patients. He provided insight on potential benefit of mobile application in the treatment of mental disorders. Second, psychologist who is also a staff at this mental health hospital. His role is to assess, diagnose, and treat psychological problems and behavioral dysfunctions resulting from a related physical and mental health. He has 15 years experience working in mental health settings. He provided valuable perception towards benefits of mobile application in the management and improvement of mental health patients. Third, a psychiatrist who is a medical doctor specializing in mental health disorders and illnesses. He is responsible for diagnosing, prescribing, and monitoring medications. He is the medical director of this hospital with 35 years experience, and also he is involved in decision making and recommendation of appropriate and beneficial mobile application as adjunct treatment. Principles of innovation. Why is my proposed solution innovative? My proposed solution is innovative because after collaborating with these exemplary professionals working at the intersection, I am reminded that for healthcare system to thrive, each discipline must intersect and interact, striving to advance innovation and transform the healthcare system. Working at the intersection, I realized the need for collaboration. According to O'Grady, 2007, each discipline within the system must create an accumulation of unique contribution that will ultimately lead to a viable and improved patient outcome and lead to a sustainable healthcare future. According to Johans in 2015, innovation comes from diverse industries, cultures, and disciplines when they all intersect, bringing ideas from one field to another. He also recommends assembling various teams of professionals to collaborate and curate innovative changes. Thank you.